I guess I have just been really excited about the community support. I've heard so many things, no one really knew what the community would do for us, and they have come forward. Not only have the construction people put this all together for us, Peg Theater was huge in actually giving the warm environment, and she still watches over all the details to make sure everything is just so. But then from all the other members of the community, I mean, every which way, people have come together and said, what can we do for you? How can we help?
The first job that I had was to look at the project as far as the space planning was concerned. I worked closely with Harley, Harold, and a number of other people to determine what needs there were in specific areas and how we were going to make them most comfortable for the staff as they were working as well as the patients. The next step after planning and replanning, and we basically started to get the word out. Carol did a wonderful job with advertising and telling people that we were in need of furnishings. At that time we had a good idea of what furnishings we were looking for, and some wonderful people in Watertown were able to donate so many different items that really made a difference in this whole project.
Working together, medical professionals, community volunteers, businesses, and community organizations donated their time and resources to help open this state-of-the-art medical facility.
Patients have been very favorable about this, and I think that it's wonderful that we can see that they realize all the contributions of the different people who have made this happen, from walking in the door to what's in the exam rooms to having their needs met. And it's been nice to change my hat from that of a person helping to develop this to a clinician helping to serve those needs now.
Some of them cry when they see it. That's the initial reaction. We had an 18-year-old who was brought in by her grandmother. She doesn't have insurance, she has diabetes, didn't know what she was going to do about her medications, and when she saw how beautiful the facility was, she burst into tears and said, "This is a real live doctor's office."
Every day, new patients find the Watertown Area Cares Clinic. They are surprised and delighted by the facility and the care they receive. Many return to volunteer.
I just thought, you know, there's this feeling when you can't work, you know, when you don't have a job and all that, that you're not worthy, and it starts to, you know, really get at you. And there are a lot of people like me that, you know, do what you can, you know, to make money and this and that, but we don't have insurance. And more employers are, you know, stopping that or putting all the expense onto the employee.
I didn't realize how easy it was to fall through the cracks until after I had lost my employment and the health benefits. So I think that's very important for that, because there's a lot of people out there that probably could use it that don't know about it too.
In January, my husband lost his job, and I was laid off in the middle of May. And so neither of us had insurance or income coming in other than unemployment. I take numerous medications. I have a lot of medical problems. And my pharmacist kind of noticed that I wasn't getting my prescriptions filled anymore, and she questioned me on it. And I told her that I just didn't have insurance and I couldn't afford to do it. And I do it at a grocery store is where my pharmacy is. I was in the store shopping, and all of a sudden somebody tapped me on the shoulder, and it was my pharmacist who came and gave me a telephone number. And she says, "Call this number, they'll help you." And so I did, and I set up an appointment. They got me in a very short time. I think I called one day and came in the next day. They were just super. They were kind and considerate. They didn't make me feel like I was a loser, which, you know, I was beginning to feel like.
The first part of our mission has been completed. The clinic is helping hundreds of citizens find the care they need, but the job is not finished. As we all know, the clinic has monthly costs that must be met. Although all but one of the staff are volunteers, there are monthly operating expenses to cover, as well as the high cost of medications.
A big part of our role has turned out to be looking at the medications people are using helping them to find the lowest cost alternatives that work for their medical condition, and then helping them get access to those medications on an ongoing basis. One of our biggest risks in healthcare right now is the fragmentation of availability of either physician or provider resources, or in this case, medication resources. And I really see one of our big tasks is helping to buffer those bridges of time when people don't have access to healthcare dollars, and trying to meet those needs by finding what can work, getting them access to it, and getting them consistent drug access until they're available through their own insurance again.